and YouTube. So now I'm on live there. This whole time I'm talking, I was not live. Sorry, you guys. You missed like a whole, 10-minute rant, but that's okay. It's all right. I say a lot of stuff, so I'll say it again. But she couldn't have moved further away from getting into hands. She ended up doing that for several years and then got burnt out, right? So I can talk about people getting burnt out all day long, but we're going to have to save that topic because I get heated about that. So she got burnt out and she ended up quitting her job without a job, right? Because that's how burnt out people get, right? She quit her job. She ended up circling back around to me and was like, what do I need to do? And in my mind, I was working at a hospital at that point. And what happened was months later, because I told her, wait, show that you're still interested, talk to the right people, blah, blah, blah. Months later, she left, right? And months later, like she left, and then a few months later, the opportunity to come into outpatient was there, but she wasn't there. So we were all like, where'd she go? And they were like, oh, she quit. I had no idea she quit, right? So you just never know when opportunities are going to come. Be ready for them. You never know when opportunities are going to come. Be ready for them, right? So if you're working in different different settings, you want to get to hand, you want a fellowship in hand, you want that opportunity, like seriously, take a class. Like, I'm not saying it like you got to take my class, but the hand therapy mentorship program we are so different because we are live. We go live every week. And even if you can't join the calls live, there's a way to engage in the program live, right? And so that's the biggest key. So when you're trying to get into that fellowship, they're thinking, what has this person done that shows that his actions match his words, right? So I hope that that's helpful. It's very long-winded. Okay, so Kendra, what's the average salary for a starting certified hand therapist? Well, it really depends on your area, right? So it really depends on your area, like Florida is very low paying compared to other states. I was talking to one of my students and, she's in Alaska. Dude, she's like, I've been thinking about moving out of Alaska, but no one pays as much as Alaska. And I'm like, that's because nobody really wants to live there. Like you start living there, you might get stuck. I don't know, but it varies so greatly. So I would take a look at your market. And then the salary of a certified hand therapist really can depend on your skills, like it depends on your skills. Like, I'm a certified hand therapist. I own my own business. I'm probably the most poor person. I'm kidding. I'm not. I'm rich in many areas. But so it really just depends on your area and on your skills, right? Tips and resources for students who are going out on level 2 in hand therapy setting. So YouTube channel. So we have one, Hand Therapy Secrets. Check out our YouTube channel. We probably put more videos out there than majority of places. Tips and resources. We have we have our 30-day free hand therapy training that you can go in there and you can kind of get an inside look into what we do here at the clinic. I know some people have purchased our Foundations of Hand Therapy. Foundations of Hand Therapy really go over the evaluation process, the questions to ask, and that kind of stuff in a hand therapy clinic. I'm in a hand therapy clinic, so I pretty much trained my therapist, and this is our method. So it's these types of questions you want to ask, it's these things that you want to try to look for, and then these are the exams, goniometer stuff, but also test measurements and then documentation, and then some splinting, like very little splinting that's in there. So send a request to be in your live. See, I don't know how to do that. Should I Colleen, I'm going to view your requests. So go live with Colleen. Colleen, did you mean to want to come live? I'm going to try it. I have no idea. I've never done this before, Colleen. Like, how do we get together on this? Did you have questions, Colleen? Oh my God, we're together live. I can't hear you. How do I do this? Is it me or is it you? I have no idea. Colleen, we might have to try this again. I don't know. How do I? Okay, now how do I get out of it? Help! Michelle! I don't know. It's okay. So I'm gonna just, Michelle's like, this is so comical. Michelle's like putting her cream on, her lotion. Oh, Colleen hung up on me. It's okay, Colleen. I'm not offended. I just didn't know how to do this. Colleen's probably like, oh my God, I didn't mean to hit a button. So drive safely, woman. So let me know, let me know in the chat, if this makes sense to you and if it resonates with you. Type into the chat, let me know, or hit some reactions, like, what is it, the hearts, the likes, and let me know if that helps, right? So the resources, really, when it comes to the hand therapy setting, it's really basic anatomy. Really, I think people just take it like, oh my God, I gotta do so much. And you really don't have to do as much as you think. The place is supposed to train you, right? But you gotta come in with some real basic knowledge, right? So if I ask you about some basic bones, like, I think that you should know that. I usually tell my students, this is what I tell them, know some basic information, right? Know some basic anatomy, some muscles. If we're seeing a lot of certain types of injuries at that time, I'll let them know ahead of time, like, hey, these are the types of injuries we see often. So that could be a question for you. That could be a question for you if you're going to an internship. You say, what are some common injuries that you see that I could review prior to coming, right? What are some common orthoses that you get to fabricate that I might be able to practice a little bit on my own, or at least get familiar with the pattern so I can, be prepared. Right, so some of those are some really simple things. Sometimes I've seen people say, learn the brachial plexus. Like, you don't need to know the brachial plexus. Like, when are you, unless you're going to a neuro place, yeah, unless you're going to a neuro place, like, you might not ever see a brachial plexus injury. So keep it simple. Keep it simple and get started there. But we do have a lot of resources for you at Hand Therapy Secrets. So our website, handtherapysecrets.com, there's a guide on how to get a job in hand therapy with some tips on resumes and interviews, I believe. And then the 30-day free hand therapy training gives you some videos and insights into the clinic and hand placements and why pick this position versus that position. Some key things like I like people to know, and like just to show what we do here at my clinic. And also there's some resume advice and some interview advice in there. Those kind of things are in there. It's like 30 day, but I forget how many videos there are in there, but there's a lot of videos. So those are some resources, right? Let's see, Kendra, I'm loving your questions. Thank you for sending them in. Do you have to start right after school getting hours? Absolutely not. So when it comes to becoming a certified hand therapist, you can take as much time. You can go as fast or as slow as you like. I know some CHTs who are great, who started out as CODAs, started working in it, getting their hours, but then wanted to transition and really move their career into a path of, moving into occupational therapy, right? So sometimes people do that because they want more autonomy. Because if you're a CODA, you're always kind of stuck working under an occupational therapist, right? Like, so if something happens to the occupational therapist, like, you don't have the job, or you lose certain hours, right? Or your opportunities might not be as great as you like. And so bridging over and becoming an occupational therapist may give you those opportunities. So it's something to consider, like I think it's a very, very much a personal choice, because there's dollars to it, there's time to it, and but the work can be very, rewarding depending on your area, right? And it just allows you to become a certified hand therapist, right? So if you're in a COTA, I know some COTAs who are wonderful and they work in outpatient, they know how to do splints and all that good stuff, right? They just can't really evaluate, and they're always kind of working under the therapist, and they can't become certified hand therapists. You have to be an occupational therapist or a physical therapist in order to become board certified and get the designation of certified hand therapy. So you can start whenever. You don't have to do it right after school. You work on your timeline, right? And you work on the timeline of the opportunities that you chase after, right? Not that just like they don't just fall into your lap. It's you're doing something specific. Sometimes the decisions that you make a year, 2 years, 3 years prior will land you those opportunities. I know that I was very purposeful. I didn't realize what I was doing. I was very purposeful when I first started coming out of school and the kind of positions and jobs. Not only did I apply for, but that I chose, right? How does hand therapy salary compare to other settings? Well, I don't think that it is necessarily the highest paying, right? It depends on your area. I don't always think it's the highest paying, but I think it's just the kind of work that you get an opportunity to do, right? A lot of people come and say to me, oh, I want to do hand therapy because I think it's easier. It's not easier. I know people who get hurt left and right being a hand therapist or treating, right? So if you don't keep your body a certain amount fit, right? And I'm not talking about weight. I'm not talking about like you got to be cut. I'm just talking about a certain amount healthy and really actually getting help when you need it, so that you don't go into a pain cycle, so that you don't go into, getting different types of tendinitis and stuff like that. And it's not always just treating yourself. Like, so I get a lot of people like, oh, but I have this and that. How do I treat myself? I think it's really, really important to get some outside perspective. And then, if you're like, I want to do it myself, have someone at least evaluate you, right? And then help you progress a little bit, before you do stuff on your own. Because we all say we want to do stuff on our own, but we're just like everyone else. It's really hard sometimes to like do everything on your own, right? And so it's okay to get help. Like, it's that mentality. We want our patients to come to us and get help, but if we can't even wrap our head around getting help ourselves, like, how do you think they're going to do it? So it's not so much about the salary as the opportunities to work in a particular place, in a particular setting, and then your salary can increase based on what you want to be able to do, what you choose to do. So I wanted to go out on my own, and it wasn't so much that it was the money, right? So I knew that if I did certain things, the money would come, right? So if you do certain things, the salary will come, the money will come. But what I wanted more than anything else was autonomy. I wanted to be my own boss. Like, I wanted to work when I wanted to. I wanted to create the kind of schedule I wanted to create. It sounds glamorous, but you also like, because you could also work all the time, right? So sometimes you work a ton, and then you get times where you can work less. But basically, it's that autonomy. It's that working towards a certain type of freedom, financial freedom, personal freedom, freedom of choice, freedom of thinking, that kind of stuff. And so it's really been an incredible journey. And one day I might share a lot more about that. But it's been one journey that I didn't expect to be, right? I really didn't expect it to be the way it has become. But I think it suits me, and I think it's very much in line with the things that I value. And the things that I value, one of the top things that I value is, growth and learning, right? That's how I can avoid burnout. Like, I don't get burnt out. I just, I continue to grow and learn. I take the breaks when I need to take a break. And, that's really important to me. All right, last question, I think. Is it hard getting a position as a new grad in outpatient hands? I don't know, Lena. Is it really hard to get a position as a new grad in hands?
I mean, I went from setting to setting to setting.
Yeah. So sometimes people go from setting to setting to setting, waiting for the opportunities.
Yeah.
And sometimes you might think that you got that setting, right? That you finally got that setting. And when you get there, it might not be quite as grand as you thought it was going to be. Right? So, you keep looking. You're like Goldilocks, You're like Goldilocks. You can't give up. Keep looking and looking and looking because, right now, this bed's going to be too hard. This bed's going to be too soft. You're looking for, that bed that's just right, right? So, hi from England. Nice to meet you. I love it. I just had someone from Quebec in our program last night. It's a lot of fun always seeing people worldwide come into the program and write to us from all over the world. It's been an incredible experience, and I hope to reach even more therapists, more hand therapists, more OTs and PTs that want to specialize in hands, because I can only do so much in my clinic here. So I'm really hoping that over time, and over, just continuing to what we do here at Hand Therapy Secrets, that more and more therapists, feel empowered and feel passionate and get motivated and inspired to essentially, specialize in hands and just think outside the box, think about different ways to help their people. But again, autonomy, like freedom of thinking and freedom of choice and freedom of a lot of things are really big to me. So I'm a big fan of independent thinking. So when I say, become the critical thinker, problem solver, and decision maker, it really comes from the thing that I value a lot, which is that a certain amount of independence. And it's not my own independence. I've got that. But I want it for you. I want it for everyone who kind of thinks like, can I do this, or can I do that, or do I have to ask permission? When you're the expert in your area and you understand how things work and you're able to critically think through and problem solve, you make that decision, you make that recommendation, and it is okay based on whatever it is that you think, right? So becoming that real independent thinker gives you so much autonomy, and it gives you like that sense of freedom and the sense of like confidence that is unlike anything else, right? So that's my thing. That's my jam. Do you guys have any questions for me? Like, because these people ask me tons of questions all the damn time, and now I'm here.
It's because we asked them throughout the day.
I know, they ask me like nonstop. I'm like, people, I gotta get work done, and then I'm like working on the weekends. What?
How do you know who you hired?
How do I know who I hired?
Yeah.
Damn, she's trying to get my secrets. Well, I literally am telling you. Like, I'm literally telling, when I say I look for someone who says, takes action based on their words, right? So that's really key for me. So I value, like, if you say something. So I get a lot of people in the 20-something years I've been an OT. I get a lot of people who say they want to be hand therapists, right? They say they want to do hand therapy, but never do anything towards hand therapy. It's as if they think that somehow it's just going to fall into their lap, and it doesn't. It doesn't fall into their lap. You have to make decisions that put you in line for the opportunities that you're looking for, right? So I often compare it to like a CEO of a company, like like the guy from Disney, right? He was on Masterclass, and he talked about becoming the CEO of Disney. He didn't wait until they picked him as CEO to do the job of CEO. he did the job of a CEO, so he had to prove himself. So when they were looking for CEOs, he was ready, and they said, you are the person who we want to represent our brand, right? So you have to sort of do the things that you say, and then, you know, there has to be some action behind it, right? Now, I've made a lot of mistakes in my hiring, but as I do it more and more, you know, I've just gotten better and better. Right? Look at you now. But, you know, so, but every single time I get better and better, right? It's just like therapy. You know, you're the first stiff finger, you're like, oh my God, what? Like, I can't do anything right, you know? And then, like, over time, now you're like, I got this, I'm going to do this, and these are my tips, and these are my tricks, and, you know, I know that there's a certain expectation for it. Like, you just learn as you go. And so I've learned as I've gone, and I've hired a lot of different people, a lot of different personalities, and like I said, for me, I've grown in, like, who I've become, you know, that kind of stuff, you know. So, like, who I was 8 years ago, you know, and I'm not the same person, but I'm not, you know. Like, I've evolved, I've gotten better. Like I'm like wine, I get better with time. And with more wine. What else? Are you guys ready?
So,
I mean, an hour later, Michelle's ready. Everyone's been sitting around, you know. Go ahead.
I called and I moved the reservation to 5:30 because they said that like if we're late, like basically
Okay.
somebody else. But if we're gonna leave earlier and be there earlier, I could call just like.
No, we'll sit at the bar. I'm a big bar person. I like to sit at the bar.
Too.
That's why we get along. You know what? We could have met at a bar somewhere, and then you'd have been like,
you know how many people I've met at bars?
Me too. Cheers.
Cheers.
All my stories start with, I met this guy at a bar.
Like a joke.
I met this woman at a bar, and yeah, for sure. Yeah, I love sitting at a bar and like having a drink first, or, you know, whatever. So, all right, what else? Oh, you are the coolest person. You guys are the best. Thank you for watching. Thanks for being here. And you know, if you guys have any questions, definitely hit me up. If you know, if you can, go and watch some videos on YouTube. I've got a ton of them there. I've got a ton of them. So definitely go in there and watch some of those videos and like and subscribe. Always looking to like grow that YouTube channel and share with people. So if you guys are watching this on replay, just, you know, let me know what it is you need. What are some topics that you're interested in learning more about? I'm always constantly putting out new things. So I go between like some career stuff, because I get like a flux of different types of questions that come in, whether it be career or whether it be therapy, like technical skills. I actually spoke about this yesterday, which is you've got your soft skills and then you've got your technical skills. At the end of the day, you need both in order to really elevate your career. And we talk about that, you know, it goes with any career. It doesn't have to be in occupational therapy, but a lot of times when people come in, they're just not really sure. They really love occupational therapy, and they start to think, maybe I can be an occupational therapist. All right, guys, we are off. We're going to go and have a team dinner. So I hope you guys have a great Friday, and I will see you on the other side. All right, talk to you guys later. Bye. Share. And broadcast.